from Negros Oriental State University in Dumaguete City. Today we are going to talk about HIV-AIDS. This report will be divided into two. Part 1 will be reported by yours truly and Part 2 will be reported by my partner Michelle Bulay Bulay. So here is the Part 1.
HIV-AIDS. What is HIV? HIV, or human immunodeficiency virus, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex, like sex without condom or HIV medicine to prevent or treat HIV, or through sharing injection drug equipment. If left untreated, HIV can lead to the disease AIDS, which means acquired immunodeficiency syndrome. The human body can't get rid of HIV and no effective HIV cure exists. So once you have HIV, you have it for life. What are the stages of HIV? When people don't get treatment, they typically progress through 3 stages, but HIV medicine can slow or prevent progression of the disease. With advancements in treatment, progression to stage 3 is less common today than in the early days of HIV. Stage 1, or acute HIV infection. People have a large amount of HIV in their blood. They are very contagious. Some people have flu-like symptoms, and this is the body's natural response to infection. But some people may not feel sick right away or at all. If you have flu-like symptoms and think you may have been exposed to HIV, seek medical care and ask for a test to diagnose acute infection. Only antigen antibody tests or nucleic acid tests can diagnose acute infection. Stage 2. HIV infection or chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduces at very low levels. People may not have any symptoms or get sick during this phase. Without taking HIV medicine, this period may last a decade or longer, but some may progress faster. People can transmit HIV in this phase. At the end of this phase, the amount of HIV in the blood, called viral load, goes up and the CD4 cell count goes down. A person may have symptoms as the virus levels increase in the body, and the person moves into stage 3. People who take HIV medicine as prescribed may never move into stage 3. The last stage would be stage 3, and that is acquired immunodeficiency syndrome, the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infections. People with AIDS can have a high viral load and be very infectious. Without treatment, people with AIDS typically survive about 3 years. Now let's go to what is AIDS? AIDS, as I have explained earlier, is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. A person with HIV is considered to have progressed to AIDS when, number 1, the number of their CD4 cells falls below 200 cells per cubic millimeter of blood. And in someone with a healthy immune system, CD4 counts are between 500 and 1,600 cells per cubic millimeter. Or, number 2, if they develop one or more opportunistic infections regardless of their CD4 count. Without HIV medicine, people with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment falls to about 1 year. HIV medicine can still help people at this stage of HIV infection, and it can even be life-saving. But people who start ART soon after they get HIV experience more benefits. That's why HIV testing is so important. Now, how do you get or transmit HIV? You can only get HIV by coming into direct contact with certain body fluids from a person with HIV who has a detectable viral load. These fluids are blood, semen or cum, and pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. For transmission to occur, the HIV in these fluids must get into the bloodstream of an HIV-negative person through a mucous membrane. Could be found in the rectum, vagina, mouth, or tip of the penis, or open cuts or sores, or by direct injection. So how is HIV spread from person to person? HIV can only be spread through specific activities. The most common ways are having vaginal or anal sex with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. Anal sex is riskier than vaginal sex. Number 2, sharing injection drug equipment or works, such as needles, with someone who has HIV. For the less common ways, from mother to child during pregnancy, birth, or breastfeeding. However, the use of HIV medicines and other strategies have helped lower the risk of mother to child transmission of HIV to 1% or less in the United States. Another would be getting stuck with an HIV-contaminated needle or other sharp object. This is a risk mainly for healthcare workers. The risk is very low. And on extremely rare cases, having oral sex. But in general, the chance that an HIV-negative person will get HIV from oral sex with an HIV-positive partner is extremely low. Next would be receiving blood transfusions, blood products, or organ or tissue transplants that are contaminated with HIV. The risk is extremely small these days because of rigorous testing of the blood supply and donated organs and tissues. Next is being bitten by a person with HIV. Each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of blood. There is no risk of transmission if the skin is not broken. Also, we have a contact between broken skin, wounds, or mucous membranes and HIV-infected blood or blood contaminated with body fluids. Also, we have deep open mouth kissing if both partners have sores or bleeding gums, and blood from the HIV-positive partner gets into the bloodstream of the HIV-negative partner. HIV is not spread through saliva. Lastly, eating food that has been pre-chewed by a person with HIV. The contamination occurs when the infected blood from a caregiver's mouth mixes with the food while chewing. The only known case are among infants. For any questions, please contact my email qr91.umali@gmail.com. Kindly click on the part 2 posted below, which will be reported by my partner, Ms. Charisse Bulay-Bulay. That's it for now. Thank you and enjoy learning. Bye!
My darling, I love you.